Good evening. We're going to get started so we don't keep you too late at the end. But please eat your food, go out and get more food if you want, or drinks or dessert looks really good. Try to stay away from it for me. But so welcome to our family night. We are very excited to have you here. And this is kind of an informal, so we're going to be presenting. If you have questions, please write it up. So in that way, you can address it at the end, so we can keep the flow of the talks, so you would remember what you want to ask. I have with me Kathy Enox, our coordinator, and I'm going to ask her this year to introduce everybody so I won't mess up any names.
That doesn't mean I won't mess up the names. So another just quick reminder as we get started, there is a survey that you got with your agenda at when registration. As you're watching, if there's feedback you have, definitely jot it down. If there's a question on there that I didn't ask that you would like to answer, feel free to put that on there. That feedback helps us create the events for future years. So I think I'll start off with just kind of listing through some of the staff that have taken the time out to come and join us today and talk with you all today. And we'll start with Dr. Nasr. Of course, you saw her. And then Amy Philbrin is here. And I'll just have you raise your hand since we're all eating. Lindsay Caverly is also here speaking tonight. And they're all from the pediatric team. Lauren Kastner is here, and her husband, Nick Kastner, has joined her. And then from the adult team, we have Dr. Simon is here, and Shijing Jia should be here as well. We have our adult NP, John Sandifer and Vikas Sood are also here. And our clinic admins, Cheryl Evans out at registration has done an amazing job this year, as usual, with organizing and getting everything set up. So thank you to Cheryl. Courtney Bauer is also one of our admins here helping out. The adult pediatric clinical research team has a table over there. If you weren't able to visit them, you can stop by afterwards. Dawn Cruz is the manager, and then we've got Marissa Lynn, Erica Blunt, and Jessica Carey. Pediatric clinic nurses are coming, but they are running a little late as they had to finish up phones. So Maria Nedinovsky, Jordan Stifler, and Katie Waite are here today. And then Ronnie Downer is here. I did see her from the adult team. She's the nurse extraordinaire as well as clinic coordinator. And then Katie Hall wasn't able to be here today as the clinic coordinator, but she had planned on it. Pediatric inpatient nurses have joined us. Liz Barron, Sue Roebuck, and Diane Brown are all here. And then adult inpatient nurses, Sarah Shee and Crystal Merrill are here. Our outpatient dietitians, Courtney Iwaniki, Sandra Boom are here. And then our pediatric psychologist, Jennifer Butcher, should be here a little bit later. Pediatric RT, Sharon Dagger, our supervisor, is here, as well as Cindy Jones. Pediatric social workers, Julie Lehrman has joined us with her baby. And then Haley Moranek, our newest addition to the team, is here as well. And then Kate Thornton, our inpatient social worker. Mara Pitcher from the adult social work team, and Brian Nickerson, the inpatient social worker. Today we got Chris Tapley from the pediatric team and Kate Tales. And then adult team, Gomati Kamfadi and Kristen Keith and Sarah Seitz. And then one thing we want to mention is our adult CF advisory board has been instrumental on the adult team. I'm not going to list all their names as they are patients, but they've been wonderful and connecting together via like a Skype program to be able to meet together regularly. So that's been wonderful. And then we have our pediatric family advisory board, which many of them have been able to be here today. So Chris and Sarah Barth I saw, Erin Boylett, Wendy Carmack, and Rebecca Rains, Heather Tremmel, and Brandy Fenner, and then Josh Fenner. All right, so this event really gets put together with a lot of support from all of our vendors. And I know you've all been around kind of talking to them, but if you didn't get an opportunity to see them all, or if you haven't got an opportunity yet, feel free at the end to kind of swing around and say hi again. And they have lots of information and take-home items as well. And so I just want to kind of run through who they are so you know who they are. And so in order of alphabetized is AbbVie, Allergan, Chiesi, Cystic Fibrosis Services Pharmacy, Foundation Care Pharmacy, Genentech, Gilead, Monaghan, Pari, Respitec, Vertex, and Vivus. And then, of course, we'd like to thank our local CF Foundation chapter for everything they do for the CF community and how willing they are to work with us as well. So we have Brent Zuber here, and Shelley Francis, Haley Malloy, and Valerie Phelps. And then I think Shelley wants to just say a few words before we get started with Dr. Nasr's presentation.
Good evening. I'm Shelley Francis. I've been with the foundation for 18 years. Kathy asked me to speak to you tonight just a little bit about some of the programs that the CF Foundation now offers. We have a community voice program that anyone can go on to our website, family, friends, patients who want to get involved and help kind of give us their input into what they feel our initiative should be going forward. So that's a really good thing to get involved with and have your voice heard. One of the other things she wanted me to talk to you about was CF Peer Connect. This is a program that helps connect CF patients who are experiencing similar issues. It used to be 18 and up, and now we have lowered the age to 16 and up. Those patients are all vetted to ensure that they follow their protocols, and so you're not going to have another kid who's giving your kid bad advice. But it also is really helpful because I know a lot of you have probably seen the movie or heard of the movie 5 Feet Apart, and it's something that we really wanted to expand upon in terms of recognizing that CF patients need to talk to other CF patients. So they can talk to them about things like career, going to college, dating even, all of those important life transitions that thankfully we now have a very large and robust adult population that really needs to be able to have someone to talk to about those things. And you can find both of those programs through cff.org. There's also Compass program, which is really, really, really critical that you all know about Compass. They can help you resolve insurance issues. They do a multitude of things, and I'll just give you one really good example because I know a lot of people don't pick up the phone and call Compass because they either don't know about it or they don't know what they do. But there was a family in another state who ended up with a $43,000 bill after their insurance, or so they thought. And for 2 years, this poor family struggled with this $43,000 bill and then finally paid it, but someone mentioned Compass and they called them. And within 2 weeks, they had gotten all of their money back. So please don't hesitate. They may not always be able to help, but they will go out of their way to try and help you. And that number is also on our website, or you can stop by. We have plenty of chip clips with their phone number on it. And the last thing I want to talk about is Great Strides. Great Strides is coming up. That fuels all of these programs and drug research and discovery and your awesome patient care that you receive here at the University of Michigan. So please, if you can, join us for a walk, even if you can't fundraise and you just want to come out and see. I know Dr. Nasr said she will be with us this year at the Ann Arbor Walk. Please come out and join us. The U of M team, we have several teams at the University of Michigan from the different care centers that participate, and they're among the best in the country. So if you want to come out and support them, we really appreciate it. But any other questions you have, if you want to know about Compass or any of these other programs, just see us. We have tons of information we would love to give you. Thank you.
Dr. Nasr always does the introduction, so I would like to introduce to you Dr. Nasr, and she can now give her talk.
All right. Well, welcome everybody. I'm really excited. This is something that I really look forward to, all our team look forward to. A lot of the people that are here from the staff and faculty are here because they wanted to come. I didn't ask them to come, which is really good and speaks volume of their dedication. So today I'm going to be talking about keeping healthy with CF. And it's a title that came out actually from talking with the Family Advisory Board because I didn't know what I was going to talk about. And they recommended that was one of the topics that came in from that. So you can make a difference. This is for the CF patients and the families as well. They can make a difference in their care and also care of others. I'll be specifically talking about adherence because that's top of the list. I mean, if everybody does their medication as they should, that adds a lot of years to their life. So this is something that's very important. The center data, I will talk about it as well, as I always do. Exercise, advocacy. As the patient getting older, you really need to be more active and more, working with the political arena, if you will, to promote CF agenda. And then touch upon transition as well. So it is a balance between workload and capacity. And we can tell you that we understand, but we really don't because we don't live it. But we know that how much work in the average CF patients put in to stay healthy. And we know it's 2 to 4 hours a day, could be more when they are sick. So it's a lot of work they are doing. And they have to also, we have to keep in mind their capacity. We want to make sure that we're not overwhelming them too much. So working with them, making sure of the time management, trying to see if there is alternative to different things so they can be at least managing and going to school and doing their activities as they would like to is important. So this is a picture of 2 of my patients. They gave me permission to use the picture. Actually, they're a lot older now. And it's just, I asked them to bring me all their medication that they have at the time, and that's about maybe 5 years old, to take a picture of it so I can show people here and overseas when I go to how many medications these patients have. They also brought their vest and they put it on for me. So it's a lot of medication. And we understand that. But the trade-off is that they're living longer, they're doing a lot better. So it takes a village, as they would say. So adherence is an important topic. In a study in CF patients using refill data, so they just got refill data from different pharmacies, at a nationwide claims database. And they looked at it and see how many medications patients are filling. And they said about half of the patients are filling their medications half of the time or less. So I've done a lot of adherence studies as well, and that number, it depends on the medication that you're doing, but that's very true, and that's like from refill data. There is significant decrease in adherence was noted during adolescent and adulthood. So at the beginning, moms are in control and dads are in control, so patients do their treatment a lot more regularly, and then they get older, and then we have the rebelling and not doing as good as they should. And then there is a low and moderate adherence rate associated with higher CF hospitalization. So when patients are not doing their medications regularly, they will get sicker more often and then end up in the hospital. So when you look at the frequency of clinic visits, that in the first part, you can see that in the younger patient group, there is about 73% of the patients come to clinic 4 times a year. And I'll show you some of our data. This is national data, but our data. And then as they get older, it's about 56% coming in 4 times a year as recommended. So you can see the trend here. So our center data, it looks at the 4 times a year visits. And then you can see that it's hard for me to turn around, but you can look at it. So our University of Michigan in patients that are 2 to 6 year old, we're about 79% patient coming in 4 times a year. And that took years of quality improvement work that we did. Everybody in the office is involved in it. Courtney is involved in it as secretarial support. The clinics staff are involved in it, the nurses are on top of it, and we also look at it as well. When a patient reschedule a clinic or cancel a clinic, we have to make sure that they're rescheduled in a timely fashion. And it's comparable to the national average. But we always are looking to be one of the top centers. So we really are aiming for the 97, 98%. Now, when you remember, the number here is 79%. Now, when you go to the patients that are 7 to 17, you can see it drop to 71%. Still closer to the national average, but the numbers are going down. And then when you go to the older ones, older than 18, you drop to 53%. So as it is, and we're matching with the national average, but it's dropping. So, and that's exactly what I was talking about earlier. This is a beautiful patient of ours. Thank you for the pictures. And then you look at the median weight for height, when we use the World Health Organization for that standards. And this is a group that we really having struggled with it. Babies are not listening to us. We keep telling them to eat more, but they don't listen. So we keep trying. So parents are trying very hard as well. And our data is getting a little better. So we are, you can see we were good here. And it's a small number of patients. So very small number of patients will make a huge difference. And then you can see that we've been struggling for the last few years, but it is getting a little better. And we have Courtney and Sandy working on it really hard to get the numbers higher. So thank you. So when you look at the patients that are 2 to 19, then now they start listening to us, right? So our data is better in that sense, and we are above national average, which is really important. For us, it's important for our patients. It's all about the patients at the end of the day. And then when we realize that the diet and telling patients to eat more is always very stressful for the patients, for the families, and if we can help in any way with that, that would be helpful. So there is a study right now called Be in Charge, and it's abbreviation for Behavioral Intervention for Change Around Growth and Energy. And this is a study that came in from Cincinnati. Cincinnati does a lot of quality improvement work, and there is a big group of psychologists there that work in it as well. So we joined, and I'll show you in a little bit how many centers are doing that. Not too many, but it's going. And it's mainly, it has developed into a website or mobile app. How about these food trackers or MyFitnessPal or things like that? How can we do that? We use things like that for children and see if that we can help them online on the spot. So they can enter data, we can see the data, we can give them recommendation on the spot. So this is really part of it. So families complete 7 different themed modules to help improve calorie intake and discuss CF and extra calories and measure food and all of these things. And we're doing that project with Courtney in the lead of that program with Dr. Butcher as well. I'm with them, helping them kind of thing. It includes the diet tracker, which is really good for the patients or parents to do it, and then we can look at it and give recommendation. And always multiple users can access it, and there is a training that goes with it. So it's really, I think it's a good program. And it took a long time. We were part of the pre-launching for the program, and it took a lot of time to get all the technology together, and the CF Foundation helped quite a bit. It's funded by the foundation. So this is kind of a snapshot of what you would see. So the technology platform, so you have a Be in Charge, and that it's a vegetable garden theme, and it tells you, different information about it. And then here it shows you the patient, and did they enter their breakfast, lunch, and dinner, or is there a problem? So it's really a very interactive program that we're starting. We recruited 2 patients up till now. So the 2 sides of the platform, us and the family, the care team uses the clinician dashboard, which is on a different dashboards. I can see all the patients that's enrolled, and then we can see the details of each one. And then the families uses the Be in Charge and the diet tracker. So that way we can help them with it. And the patient's age is 3 to 10 years old. And like I said, Courtney, I don't see her. Okay, right. So Courtney is recruited 2 patients already. So recruited 1, and then last week when I was out, she recruited a second one. So it would be interesting to see, and we're trying to see how it would be the best and the easiest. Also, Mrs. Boylet is our parent advisor in that program, and that's really important because I have my opinion of what would work, but that might not be correct, so she's there to help us out and also helped with developing the program as well. These are the group of people in the study, so us, and then Boston Children's, Children of Richmond, Virginia, Cincinnati, and then the Stanford group, and then Children's of Colorado as well. So it's not a lot of centers, which you don't want to be a lot of centers at this stage, because you want to see how you can work the program the best, and then you can generalize it. So the idea is hopefully it will be generalized to everybody. But we're very excited to be part of that. So back to our data. So this is for patients, the median BMI for patients that are 20 and older, and you can see how much beautiful their data is. And that's actually, I think, part of it is that they have extra dietitians help, which is really, Dr. Simon worked really hard to get that going and to convince the adult side that we do need extra dietitians for the program. So they've been doing really well with that in addition to their nurses as well. So this is also one of my patients. I don't know if the parents are here. So. And looking at FEV1 for 6 to 12 years old, and we're matching with the median for national, but we're getting a little better. But the next one is even better. Yeah, really, isn't she cute? Thank you for the picture. Well, we asked for some pictures, and then the parents sent us, so I used all of them here. So this is for patient 13 to 17, which is really the toughest group for me to work with because they don't usually, they have their own way of doing things, and usually adherence go down with this group. But look at it, you know, the data is getting better too. Now I have to mention, we have a huge quality improvement project that we started, 2 years ago, I think? About 2 years ago, and we're working really hard, and every discipline in the center is working on it, like nurses, dietitians, social worker, of course, respiratory therapy and physical therapy are working on it, social work, I don't know, psychology. So everybody worked together to get improvement in the pulmonary function testing. So, and I think it's paying off. We're seeing, this is the data from last year, so it would be interesting to see this year. So exercise, and again, I use pictures from my patients. So exercise in people with CF is really important, and the level of physical activity and adherence to exercise program are low in CF patients. A lot of them just, you know, don't want to exercise, and parents don't want to push them because they don't know if they can do it or not. And then the reason is lack of exercise tolerance. Maybe they get tired, so okay, you sit down, don't worry. And then also, not wanting to do it, and I just want to stay home kind of thing. So that's important to keep in mind. Having said that, there's a lot of my CF patients that are very active, and they bring me pictures, and they showed me, and they tell me how much activity they are doing, and it's very exciting. So physical activity is a key element in CF treatment strategies. Physical activity includes structured exercise, which would be the best, but any exercise is good. And it's essential. And physical exercise training may form an important part of the care of the patient. And actually, there are some organizations, we just did a Facebook Live on Friday, and we had Emily Scheller with us on the Facebook Live, which I've never done before, but anyway, I think it was fun. And she was saying that her organization, actually the ROC CF, would give walking shoes or running shoes to everybody that want one. So I wanted to publicize that. So if your kid wanted to run or do something like this, you can actually go onto RockCF website and she will send you a shoe. So which is encouraging the patient to do more activities. This is cheerleading or band. I don't remember which one. Yes, you can. Band, right? So exercise in people with CF, the benefit from including physical activity is really great. And I have some patients that would come to me and say, in the summer, I do much better. My lung function is a lot better because I run around a lot and I jump on the trampoline and I do swimming. And my numbers, when I say, oh, your lung function is better, because I exercise in the summer more than in the winter. So that is really important. And any activity is good. And this is my favorite. So then, so exercise is important. We need to really make sure adherence, exercise. Now we need to really, there is a new push on partnering with the families and the patients. So it's an oldest new idea to improve CF care. There was a session about it in the the National CF meeting that I thought it was very helpful. So the opportunities have assertion, vision, key strategies, but the important part is the 7 worthy goals. And these are the 7 worthy goals. So patients and families are full partner with us, so we really need to work together. I love it when patients come, I'm being sarcastic, when patients come to me and saying, I'm doing everything on my list, and I know very well that they are not. So it's not for my health, it's your health, so you need to tell me what's happening so I can help out. So it's full partnering with the patients and with the family. We're aiming for normal growth and nutrition. We're aiming for maintaining lung function at the best. Reducing acquisition of respiratory pathogens. And I don't know who saw the new movie. I have not seen it because I was traveling. But, it's very important. It's 6 feet, not 5 feet. So just remember that. And also important not to be around other CF kids. Look for complication and make sure to address it. Transplantation and palliative care, and then access to appropriate therapies and treatment is very important as well. Okay. So co-production is another terminology that is being used right now with CF, and it's about the patients and professionals. It's partnering with them. We need to partner with the patients and with the family, and I'm sorry I keep saying patients, it's people with CF, to better use of each other's assets. So try to talk to me more, or talk to your physician more to see how they can help you, and then we can talk to you more and see how we can have the treatments around your lifestyle and your things that you wanted to do. So Health Canada's public improvement continuum. So to have public improvement continuum, you have to communicate, you have to listen, consult, engage, and that need to the partnering. So I cannot say I'm partnering with my patients if I'm not doing all of that. So, and if your physician is not doing it or your nurse is not doing it, talk to them. Make sure that you voice your opinion about this as well, because we really need to work together as partners. All right, so at the end of the day, it's all about the patient, all about the people with CF. I'm here because of that. All my team members are here. You're all here because you care about your children and your adults, and you want it to do the best for them. And to do the best, we all have to work together to get the community to understand, to get the health system to understand, and to make sure that we are doing the best for the patient. So, and better partnering with the patients lead to a lot of outcome improvement, and you can see that from all these publications that's available. Now, the last one, or the one before last, actually, is the advocacy. Very important at this stage in the game to be advocate for your child with CF and your adult with CF. You cannot just sit home and not do much. You have to be, any opportunity you have to do advocacy work. And advocacy work can be a lot of things. It doesn't have to be that you're going to the state capital and working with them, but you could be doing a lot of things, like, even talking to people about the movie, or educating people about CF. That's part of advocacy as well. So that's very important, to empower the patients and the families, and to coordinate with your caregivers and with your Congress people to make sure that you're doing well, and then just make sure that they hear what you need to, what you have to do. And the reason for advocacy that is really important is this slide. So you can see that patients are getting older. And you can, especially from this slide over here, this is the number of patients that are under 18, and this is the number of patients above 18, and they are straight line up. So now I can say that the adult program is bigger than the pediatric program. And I fought that for so many years, but I'm very excited that's happening. And that's really because of the improvement in medication that we have for the CF patients, the more partnering with having with the patients and with the families, and also with the importance of focusing on quality of life. You don't really just want to live longer, you want to live longer, healthier, and doing better. So now goes to transition. So our kids are getting older. We have to pass them on to the adult side. And we really wanted to do it in an organized fashion, and in a way that they are not just moved from pediatric to adult, or they feel abandoned, or all of a sudden I'm taking care of them for 18 to 21 years and I'm passing them without preparation. So that's very important. So we have a program called CF Rise, which is responsibility, independence, and two other abbreviations. I tried to remember them, but maybe Julie can help me over there. Self-care and education. So there are two programs. One of them is 16 and above, and this is what I'm having here. So it's mainly tools that we use, because I think some of the adolescents are not listening because maybe they don't know enough about CF, because we always talk to the parents, not including the children or the adults, young adults. So we started by going through the elementary things. How is CF for you? Do you know what CF is? So that's really important. So we have a knowledge assessment. So we're not telling them, okay, we're gonna do a transition program now, you can go to adult. We start at 16, and we usually give them the modules. Choose a module you like out of the 11 that's listed here, and work on it. It's not too long. It's maybe a couple of pages, and immediately give you a response if you do it online on your iPhone or iPad or whatever. And then that way, and then if there are any deficiencies, then we can work with them to correct it. The team members will address it. And the idea is not to do it once. The idea is to do it more than once to make sure they're okay with that. And then the responsibility checklist. Now, we're in pediatrics. Moms and dads do everything for the kids. That's what I did with my kids as well. And the idea is to get them to behave like an adult. So responsibility checklist, make sure they call us when they need refill, make sure they make appointments for themselves. And that start gradually, make sure understand what insurance is about. So that's really important. And we give one to mom and one, or dad, and one to the patient, and see how they answer it. If the kid's saying, I do everything, I call, and I do my refills, and then mom or dad would say, we do everything. So there is a disconnect here. So we work with them in gradually moving them to be responsible. And it depends on the age as well. So you don't want to have a 16-year-old calling all the time and doing all the insurance issues, so you gradually have to move them there. So having said all of that, the bottom line is this slide. This slide shows you how much work we're doing for CF. I just came yesterday from an investigators meeting for another study going on. We are having more physicians involved in research. Dr. Gia is participating with us from adult side. We have Dr. Caverly and Dr. Felberin working with. So it's not only me doing the research, it has to be a lot of people because it's a lot of studies. And you can see from there that so many going on in phase 2 And then you have to see whatever makes it to phase 3 is less, but we have a lot of phase 2 going. We have some phase 1 as well. So bottom line is there is a lot more things coming down the pike. We have a lot of new advanced and new medications, so we're very excited about it, but it's a lot of work. So shout out for research. Please, when Dawn and her crew come to you and ask you to participate in a study, don't just say no, try to listen to them and see if it's feasible to do it, because more studies meaning more things available for CF patients. And with that, thank you.